Well, the doctor is in with a potential breakthrough in heart health, a new class of drugs that could dramatically change what is commonly called bad cholesterol. It's not in the form of a pill, but it's in the form of an injection, and the FDA has to decide whether or not we're allowed to use it. Joining us now, Dr. Kevin Campbell, practicing cardiologist and an assistant professor of medicine at the University of North Carolina. So, Dr. Campbell, we talk about these headlines when there's new drugs on the market, but you say there's a really interesting backstory to this drug and how it was developed. What can you tell us about it?
You know, this drug was developed because of observations made of a family in Paris who had terrible heart disease, and many were dying young. And they found a particular enzyme or protein that was found in high levels in that particular family. Then another family had almost undetectable cholesterol levels, no heart disease, and that particular enzyme was at really low levels. So the drug developer targeted that protein as a target for the drug, and that's the backstory behind the development of this drug.
It sounds genius, right, to observe these specific families with these particular dispositions. So how exactly does this drug work that's different from what's already on the market?
So as we know, the statins are the best drugs available right now that are approved, and they work in the liver to change the way we metabolize cholesterol. However, these new drugs actually work and block this particular enzyme and lower the levels of bad or LDL cholesterol to unheard of levels. We're almost 50, 40, 30, which is, we target for 100. So this is a big, big deal.
Why do they have to be injected?
That's a great question. So these particular drugs are actually antibodies, monoclonal antibodies, and if we were to take them by pill form, the acid in our stomach would destroy them and they would be ineffective. So we inject them just like an insulin shot. It's not an IV, it's just under the skin, and patients can be taught to self-administer.
That was my next question, whether or not you had to go to the doctor's office to actually get the shot, or whether or not you could do it yourself, which it sounds like that could happen. What about getting this drug to market, doctor? And just, let's take a big step back, perhaps even before we get there. What do you think about this? I mean, is this a game changer? Do you want your patients to be able to access this drug?
I think this is a game changer. I think more study needs to be done, however. What the studies that were presented in San Diego at the American College Cardiology meetings that I attended showed were that these were safe and effective at lowering cholesterol. They went back and looked at the numbers, and they found that they also lowered heart events, heart attack and stroke, by 50%.
Wow.
So now we need big, big clinical trials to use those endpoints to make sure. However, I think the FDA is going to release this probably by the end of the year, even before that data is available.
Really? Because of the success that they've seen already?
I really think so. I think this has a potential for a game changer. I think that we've got to figure out, A, how to pay for it, because it's going to be very expensive, and then B, which are the appropriate patients. It really is another arrow in our quiver to allow us to fight heart disease, and this may be the biggest drug in the last decade.
It all sounds really good. I was taking a look at the side effects, though, because apparently there's some question about the side effects, because some suggest that the side effects could be an impact on thinking, confusion, and memory, although from what I've read, that can be difficult to determine whether or not it's attributed to the drug or, just life. What about those side effects, and what should our viewers be aware of, Doc?
So the side effects that were reported, about 1.2% of patients in the study that were reported this week did have memory changes, difficulty remembering things, and that could be significant, particularly in a patient population that's aging and may be dealing with dementia and Alzheimer's and that sort of thing. I think these big clinical trials that are going to be probably completed in 2017 may help us answer that question. So I think the jury still needs to remain out before we say this is the best thing since sliced bread.
It's a very interesting, again, like you said, what is arrow in the quiver? Is that what did I say that right?
Exactly.
Speaking
Another
of memory
arrow
problems,
in our quiver.
I mean, I didn't even need to take the new drug to get to that. But it is interesting. It's a very interesting new study, and it certainly caught our attention because so many people are affected by this. So thank you, as always, Dr. Campbell, for your expertise on it. We really appreciate it.
Thanks for having me, Jenna. You guys have a great St. Patrick's Day.
You too.